Hi, my name is Lisa Ware. This is a video response to building capacity and substance abuse for those who are addicted to opiates. This prevention targets IV drug users but can be applied to other substance of abuse. The program aims to grow and make available local resources and readiness to deal with the identified need of opiate prevention and treatment. According to the Substance Abuse and Mental Health Service Administration, 2006, a community needs both human and structural resources to establish and maintain a prevention system that can respond effectively to local problems and people who have motivation and willingness to commit to local resources to address identified prevention needs. The capacity of this prevention program is built on supported prevention programs and intervention that are supported with resources and readiness with success in mind. The key components to successful capacity building are raising the stakeholders' awareness, engaging diverse stakeholders, strengthening collaborative efforts, and prepare the prevention workforce. Raising the stakeholders' awareness benefits the community because increase local readiness for prevention by making people aware of the problem, and making people aware can safeguard them against the addiction. And raising the awareness of stakeholders, it is suggested to meet with public opinion leaders, ask stakeholders to share information and their division, post articles in local places, restaurants, church bulletins, newspapers, websites, and social media sites like Facebook. An annual recovery marathon to support the cause and share information about the opiate epidemic and how one can help with the intervention and prevention measures of building the program's capacity. And bring together focus groups to get their input on prevention plans are all efforts to raise stakeholders' awareness. According to SAMHSA 2006, engaging a broad range of stakeholders is key to unlocking a community's capacity for prevention. And effective prevention depends on the involvement of diverse partners, from residents to service providers to community leaders. The local government, community centers, health care providers, neighborhood watch group, and schools and universities are just a few of the diverse stakeholders to be considered for building capacity to engage about opiate epidemic. It is a good practice to build strong relationship with those who support your cause of saving lives through drug abuse prevention and intervention. Strengthening collaborative efforts is another area, and building capacity that requires people working together to address problems. All can be done by involving experienced professionals and multiple players. Doctors and pharmacists can partner together to address this issue. Law enforcement can partner with Neighborhood Watch, and children can support other children who are exposed to drugs. The success of any preventative effort involves preparing a workforce, which involves working with federal and other partners to increase, train, and culturally competent, aware professionals to address the nation's behavioral health needs. The workforce consists of trained professionals but is not limited to who can work together for the same cause of prevention and intervention. How might you improve awareness of substance abuse problems and readiness of stakeholders to address these problems? One can improve awareness of substance abuse problems and readiness of stakeholders to address these problems by educating oneself by using the Center for the Application of Prevention Technology, CAPS. CAPS provide technical assistance to state, jurisdictions, and local communities in applying science-based research to alcohol, tobacco, and other drugs prevention. SAM's prevention framework is used to address a large, diverse population and prevention and intervention. Improvement of awareness can be made by targeting the issue that put individuals at risk for drug use, such as exposure to drugs, teen pregnancy, school dropouts, suicidal ideation, and violent crimes. A community health promotion is a prevention effort to address groups and large populations that target a complex and interdependent educational, social, and environmental actions of a population that contributes to the health of the community, which includes high-risk individuals, families, special populations, and policymakers. The government has given the month of September to the National Recovery Month. This raised the awareness of the issues of addiction to everyone that is aware of the month of September. In the town where I live, treatment centers came together to have an event at one of the mega churches where SAMS was present to support the cause. Individuals who donate their funds to support the war against drugs was also at the gathering. Psychiatrists, substance abuse counselors, program directors, doctors, and nurses were there to support the event. All of these are efforts to raise awareness of the stakeholder. What can be done to strengthen existing partnerships and identify new opportunities for collaboration? According to SAMHA 2006, collaboration can help you tap the resources available in your community, extend the reach of your resources by making them available to new audience, and ensure that your prevention efforts are culturally competent. By working with the local partners such as churches, rehab, clinics, step-down programs, inpatient programs, recovering addicts, self-help groups, supporters, and so many more that will participate in implementing, planning, and evaluating efforts of prevention and intervention on substance abuse and addiction. This will strengthen existing partnerships and can potentially present new opportunities for support. One must strategically plan and be clear about the purpose of and be clear about the expectation of those involved. Building the strength of existing partners require regular meetings to check the process of their involvement and to see if their needs are met. Although many of the partners start out good, in order for these partnerships to remain in good standing, one must work at nurturing them. Strategies might you use to improve organizational resources? Okay, identifying needs for programs and opportunities for collaborations are one of the first strategies to use to improve organizational resources. Collaboration is an appeal reach prevention resources. Collaboration is an appeal to reach prevention resources. There are three types of prevention resources: physical, human, and organizational. in reference to the question organizational resources, which refer to vision and mission that support collaboration and or the prevention of behavioral health. What needs to be done to develop and prepare a workforce? Developing and preparing a workforce is an effort to make sure that the program is successful. This requires skills and knowledge for those involved. And as for aforementioned, the workforce consists of trained professionals but is not limited to who can work together for the same cause of prevention and intervention and ensuring that those involved are who they say they are is a good practice to safeguard harm.